Hi everybody, Dr. Matt here again talking about patellar tendinopathy. So in our last episode we showed you the beginning stages with isometric contractions, and now we're going to progress on to isotonic contractions. So we're keeping the same amount of weight and we're having a nice slow pace, trying to keep time under tension. Again, this is for patellar tendinopathy. So I'll get you to pan over here to Kaylee. So we're first going to do this without any load. And if you can do this, if you can have your heels slightly up, so that's going to put more tension on the patellar tendon. So what she's going to do is squat down, and we don't want her to go past 90 degrees at the knee. So she's going to squat down 3 seconds, 1, 2, 3, and then up 1, 2, 3. So that's 1 rep. Okay, so I'll get you to keep going there, Kaylee. So as she goes down here, she's again not going past 90 degrees. The reason why for this is they've actually shown if you go past 90 degrees, it actually increases the amount of compression on the patellar tendon at the inferior pole of the patella. So we don't want to do that because that'll actually make your tendon more like a joint, because again those cells will respond to compression similar to how a joint will. So we only want high tensile loads for right now. As someone gets further along in the rehab, we can add more compression. But again, in these first stages, we don't want to do that. So she's going to continue on here. So in the first week, she's going to do 15 reps, and she's going to do 4 sets of this. So 4 sets of 15, and each rep is 6 seconds. So a 3-second descent and a 3-second ascent. So going up and going down. So typically what we do with this is a 12-week program, and you're adding weight as you go. So weeks 1 to 3 is 15 reps. Weeks every 2-week interval after that, you go from 12 to 10 to 8 to 6 reps, and again it's 4 sets throughout the whole thing. So that's exercise number 1. So I'll get you to stop there, and now I'll get you to grab the kettlebell so we can again start to add load. You wouldn't change it within 1 session, but again we're just showing that you can increase the load while you're doing this. The pain during the rep should not exceed 3 out of 10 on the numeric pain scale or visual analog scale. And she'll tell you that she's feeling that in the quads and feeling a little stress in the patellar tendon, which is good. Okay, so now the next exercise that you can also do with this, because we want to get some unilateral work in as well, because it's not always the fact that you're going to have patellar tendon equally on both sides. So we can get a lunge. I'll actually get you to face Rochelle here. And you can just stay in place, and we're again the same rules, so don't go past 90, and slow descent coming down. And come on back up. So this would be training the lead foot, okay? And I would suggest that you do both sides. So before she switches here, you take that. Good luck. And 3-second descent and 3-second ascent. You can do different exercises than this. The exercise selection necessarily isn't the most important thing, but it should correlate to what the individual is actually doing when they're having the pain and the activity that they're doing. So if they run versus, let's say if they play basketball, there might be more jumping. So maybe a squat might be more relatable to a jump, different things like that. So exercise selection, it should just make sense that we're loading up that patellar tendon in a good position, and you can put time under tension. So again, I'll put a resource on the bottom of this video. If you have any questions, please reach out. Thanks.